Hi, everybody. I'm going to try to explain what I couldn't explain earlier because we got cut off. So I'm on the mystartmap.info page, like I talked about. So this is the statewide view. If you drop down the epidemic spread, you'll see the test results. You'll see that for the entire state of Michigan, the average positivity rate for all the tests being done is about 3.5%. So about 3.5% of the people being tested for COVID are positive. And if you track over this, you'll see the trend as it's been going backwards day by day. Okay. And I'm just going to scroll down here, going down to the public health capacity, because this will show how many tests per person population are being done, which is more useful than the total number you'll see as we go to the counties. So about 2,500 tests per million people are being done. So this is the trend again over time. It's been just gradually increasing. So you want to see that because if too few tests are being done, you could argue that that would affect your percent positivity. So 2,500 per million is the state average. I'm just going to sneak back up here again. I'll try not to make you dizzy. And if we go to new cases, we'll see in Michigan, this June 1st, right here, is where stay-at-home ended. And 2 weeks later, you can see, whoop, we start going back up again. And then 4th of July hit, and now we're starting to go back down again. But the average number of cases in Michigan right now are 35 per million each day are being diagnosed newly. So that's new cases per day. So over the past 2 weeks, it's ranged between 55 to 35 per million. So I have those written down so I can refer back to them so we can kind of compare it to how each county is doing. So if you want to see your county, click on here. Then the region pops up. So let's start with Wexford, just for the heck of it. So test results. Today, well, it would have been a couple of days ago, was 1.3% positive. We trend backwards. You can see, I know it's tiny, tiny number here. I'll try to make it a little bigger. So there's been times here where it's been less than 1%. Back here around the 4th, we were a bit higher at 2.4%. So we had talked earlier today that if we see it at 5% and rising, that is suggestive that the community spread is high enough that we would worry about having in-person school, or if at any point it is above 10%. And you can see that those are the cutoffs. 10% is where we say, gosh, that's too high. So that's the red line here. You can see the lines here. The state has set 7 to 10%. Again, these are not thresholds they've set for school. It's just in terms of risk. But again, Wexford County, looking at the number of tests that they're doing, right now they're at 1.3 thousand, so 1,300 per million. They've had times where it's been higher. So we do know that testing ability is limited by how many supplies they're able to get. So they have had times where it's been higher, but right now it's a little bit lower, but they have been in the past closer to what the amount the state is doing. Cases per day, 12.9. Again, remember the state was at 35. It's been a little higher and a little lower over time. Again, this 4th of July, and it's come back down, and it's trending down again. So at this moment, the community transmission rate is set at medium risk. So we'd agree with that. We'll pick Crawford. Now Crawford right now is at 2.9% positivity. They've had 62 cases per million. Again, they're a smaller county, so that they only have 0.9. So less than one person was infected. And this is a 7-day average, so there's a way of kind of averaging it out over 7 days, so it's a more smooth line. They have had a lot of cases in nursing homes. And so when we look at situations in counties, if we're seeing big increases, we might look at where those cases are happening and how that would affect schools or wouldn't affect schools. They have had some good increases in testing, so they are actually above the state average with testing. So to see a low percent positive, relatively low percent positive with good testing numbers, that's pretty reassuring. Look at Roscommon. I'm not going to look at all of these because it'll take quite a while, but so Roscommon has a very low percent positive rate, less than 1%. They're testing quite a few people for their population above state average. They have had some bumps in cases, but again, cases per million around 30. Still, that's just in the medium-high range, just over the medium-high range. For their population, though, that still is not that many. And we've seen some issues with Houghton Lake and Higgins Lake having some recreational activity that's caused some outbreaks. So I shouldn't say outbreaks, just some increased activity. But again, reassuring given the small percentile that's been positive. So let's go down here. I'll show you another example. If we look at Oceana County, their current percent positive is 2.6. However, if we go back, it was quite a bit higher earlier this summer. Most of those cases, however, were related to several agricultural and factory-based outbreaks, really not community spread. So this would be a time where you might say, oh my gosh, look at this percentage, but we may talk and say, you know what, this really doesn't affect school, unless it was getting into parents who had students or into the students themselves. But this has really come down, and now we're back under the 5% and dropping. The cases too, you can see were really up, but now we're back down well below the state average and dropping. And the testing capacity is above the state average, so we're doing a good job testing people there. Look at Montcalm County, which is in a different health department region. Percent positivity is very low, less than 1%. It doesn't get above 2% until early in July, so around the 4th of July. And the case count has been steadily dropping. There have been times where it's been higher. Back early July, it was quite a bit higher, but it's been steadily dropping. And our testing in Montcalm, they do a great job with testing there in their healthcare system, and it's above the state average. We'll hit Isabella. Again, low positivity. Low case counts, dropping over time, and increasing testing capacity around the state average. Got Mason, I know we talked about Ludington had said that they had high. As I'd mentioned, they were at 0.8% positivity. They've been quite low all along. Higher right after the stay-at-home order was lifted. Case count was higher earlier this summer, and it has dropped down. And testing capacity is the same as the state average. We have some counties over in this region, so we'll look at Gladwin. and low percent positivity. They did have a spike, and you know that we had some cases with a camp outbreak, but we're coming down. Remember, the state average is 35 right now, and our testing capacity is on the lower end, but it's still pretty consistent. So just for point of reference, if we look at Wayne County, their percent positivity is 5.2%. Their cases are 50 per million, which again, ours are much lower in our counties. And they're testing about 2,700 a day. And if we look at, let's look at Kent County. Their percent positivity is not that bad. Their case count is pretty high. They're up above, they're up in the very high category. They're just starting to drop down, which is good. And they're doing quite well with their testing efforts. So just as comparison, you can see how some other counties are doing compared to ours. Clare, my county, you can see we've had some increases in percent positivity lately. Starting to drop off again, still well below 5%. Did have some increases in case counts, but those are coming down. Again, you see the 2 weeks after 4th of July coming right down. Testing here, like Gladwin, is a bit lower, but it's consistent. So still at this point, well within the range. Mecosta, 1.2%, quite low positivity. We have students returning to Ferris, so whether or not that's part of the blip here, but still in the medium high range, and so not terribly high at this point. Definitely lower than it was that phase after the 4th, and good testing efforts. So I know I didn't go over every county. Most of the other counties are very low, but you get an idea of how you can look at those numbers yourself. We'll work on trying to share this information, but this is a really good way that you can look, and it's constantly updated, and it is a good way for you to see how your counties are faring in terms of activity. Certainly there may be pockets within certain cities that may be more active. I will go over Clinton. I know Clinton County is a bit more affected, but still their percent positivity has been in the 3% range more recently. They have had definitely some high count days. There has been a downward trend just over the last several days. Hopefully that will continue. But they are, like I said, they have had some high days. So part of East Lansing area does dip up into Clinton County, so that definitely can play some factors there. They do have very good testing efforts, so can keep a good eye on things. But that is one county where they do see some higher numbers. But again, things are trending down, so hopefully we'll have some good luck. And again, good testing efforts and still a low percent positivity. So the community spread rate still seems acceptable at this point. So anyway, that is how you look and see how your county is doing, and you can compare it to some other counties. I know earlier today I looked at Grand Traverse just to look. They had some times when they had some higher case counts. Again, I mentioned earlier, Labor Day weekend may give us a bit of a blip like 4th of July did. It doesn't necessarily mean that schools have caused a problem. And so we'll hopefully help with some of that messaging to help you out. Thanks so much.